Hi, my name is Dr. Petzel, owner of a DC Chiropractic and Massage in Hinsdale, Illinois, and today I wanted to talk to you a little bit about the topic of car accidents and personal injury cases. So most people don't think of car accidents as anything too major to the damaging structures of the spine or even the damaging structures of the soft tissue, but newer studies are actually showing that there is large amounts of damage to the ligaments in the upper spine that occur during these whiplash accidents. So there are about 1 million cases of whiplash that happen in the United States every year. And whiplash can occur at speeds of 15 miles per hour or even less. It all depends on the acceleration and deceleration of the car. Now, in this first study that I wanted to show you, it shows that we have support for the soft tissue structures being damaged in the upper cervical spine. So we have the different ligaments, the alar ligament, the anterior and posterior atlanto-occipital ligaments that are also damaged in the accident. Second study we have here, we notice by the same guy, has an MRI showing of the tectoral and posterior atlanto-occipital membranes being torn and actually being able to be seen on MRI. Third imaging or study that we have here is a study that shows a strong association between the alar ligament being disrupted and the reported pain and disability that occurs. Now let's take a look at some of these images that we have here. So here is the anterior atlanto-occipital membrane and the posterior atlanto-occipital membrane. As we can see here, these are both fully intact, as there is a black margin which right here shows that it is fully intact. Now let's take a look at the next image. Here is a zoomed in image, and we can see where the black is the normal part of the atlanto-occipital membrane, and we have the tearing where we have the grayish coloring of the membrane. Here's another case where we can look into the ligaments. This is going to be looking at the alar ligament. Here is a rendering of what we'll be seeing, and here you could see the disruption with the grayish or the light gray color and the dark gray or the black as the actual full membrane. So you could see both here and here there is a disruption by having a grayish color, meaning that there is a disruption of this ligament. Now, why is this important? This is important because these studies are showing that with accidents, it's not just a soft tissue injury, that we actually do have ligaments tearing, no different than what would be an ACL injury or a PCL injury, which is very common in the knee. Well, here we've got tearing of a much more important structure, being the structure that stabilizes the spine in your neck, and is responsible for making sure the integrity of the upper cervical spine is healthy. So just wanted to give a update on that and let everybody know that a whiplash injury is actually much more serious than most people make it out, and the soft tissue damage that is being done is extremely delicate, as well as needs to be addressed through some sort of treatment. We deal with it all the time in our clinic and have much experience with personal injury cases, as this is a big part of what we do. Hope this helps, and if you have any questions, contact us at either email drpetzel@adchealth.com or call us 630-887-1900. Thank you.